Good afternoon, everyone, and thank you for joining today's press conference. Today, all speakers are joining the briefing virtually to adhere to social distancing guidelines. The topic for today's briefing is an update on the COVID-19 pandemic response. We will begin our briefing with opening remarks from Health Commissioner Dr. Thomas Farley. Dr. Farley, you have the floor.
Good afternoon. I have better news today. Our case counts have been falling for the past 3 weeks, but the case counts are still high and we still need to be careful. So here are the numbers. Since this time yesterday, we've identified 822 new cases of the coronavirus confirmed by the PCR test in Philadelphia residents, bringing us to a total of 90,351 since the beginning of the epidemic. And in addition, there are 103 new probable cases diagnosed by a rapid antigen test. Now, in part, these numbers are high because we received a very large number of laboratory results today, almost 12,000. To put it in context, over the last week, from December 20th to December 26th, we averaged 502 cases per day so far. Expect more with late reporting. And of those people tested, 9.0% tested positive. Now, just to note that there were fewer tests done last week because of the holiday. But in the previous week, December 13th through the 19th, we averaged 679 cases per day, and 9.4% of the tests were positive. So you can see the decrease there. And what about hospitalized patients? This morning, hospitals reporting 784 patients with COVID in the hospitals, and that number has been decreasing since December 17th, which is a good thing. What about deaths? Since this time yesterday, we've identified 38 new deaths from the coronavirus in Philadelphia residents, bringing us to a total of 2,406 since the beginning of the epidemic. Now that number, although it's a high number today, overall has been decreasing. To give you a sense of the numbers, for the week of November 29th, we had 94 deaths. For the week of December 6th, we had 86. In the week of December 13th, 69. Now expect more deaths reported to us because there are a lot of delays, especially for reporting deaths. But the fact that these numbers are decreasing, even though they're high, is a sign that the lower case counts may be leading to fewer deaths, which is a positive sign. Now, a few words about our vaccine. Remind people that we have a small number of doses available, but overall the vaccination initiative is running very smoothly. We're still vaccinating the first group of people. Those are people who work and are exposed to coronavirus in healthcare settings. I include in that emergency medical technicians. We put up a dashboard on our website starting yesterday showing the number of people who are vaccinated so people can follow along to see how the initiative is progressing. So far, we have data showing the vaccination of 18,366 people. Now, this week, we were allocated from the federal government roughly 8,800 doses of the Pfizer vaccine and 9,200 doses of the Malandra vaccine. We expect to get roughly the same amount allocated to us each week for the next 2 weeks. It's a relatively small amount of vaccine. We'll be continuing to provide that vaccine to hospitals so that they can vaccinate their healthcare workers, but we'll also be expanding to other sites to reach non-hospital-based healthcare workers, including, for example, congregate health facilities like behavioral health facilities. Now, also this week, the pharmacies that have a contract with the federal government to provide vaccinations in nursing homes for nursing home staff and residents will begin doing that. And we'll be providing information about additional sites where testing will be available in the coming weeks. But just to remind people again, the number of doses we're receiving is small. So people who want to be vaccinated, including healthcare workers, are going to have to just be patient in getting the vaccine. Over time, everyone who wants this vaccine will get it, but it's going to take us a long time for it to make it available to people. Then a few words on the new variant of the virus. Just to remind you that there's a new variant of the virus that was first recognized in the United Kingdom in recent weeks. It appeared at a time when case rates in the United Kingdom surged in December. Now, when new studies come out since last week, which suggested that this variant is 56% more transmissible than the virus that's circulating here in Philadelphia right now. The New York Times reports that this new variant has now been found in other countries in Europe, several other countries there, as well as in Japan and Canada. Now, the new variant has not been identified in the United States yet, but this new variant can't be determined by a regular PCR test. It requires a special test called genome sequencing, which is complicated to do. That test has only been done on about 50,000 of the people who have positive tests in the United States since the beginning of the epidemic, and that's about 17 million positive tests. So I would say it's likely this new variant is somewhere in the United States right now, but simply not been recognized yet. Now, laboratories in the United States, coordinated by the CDC, will be testing a sample of the new positives on a regular basis to see if we can identify when this new variant appears and where. I would say here in Philadelphia, if anyone has recently traveled to the United Kingdom and then test positive, contact the health department, and we may request a sample for further testing. Now, if this new variant does become prevalent in Philadelphia, and if it is much more transmissible, that's not a good thing for us. That would mean that case rates would likely increase. But it's important. It's not proven yet that the new variant really is more easily transmitted. At this point, I would still describe that as a speculation. There are other possible reasons for the surge in the United Kingdom. We also think that this new variant should not cause a more serious infection in people who get it, and that the new variant should be prevented by the vaccine, just like the virus that's circulating in Philadelphia now. So what should we do to protect ourselves against this new variant? Well, first of all, just double down on the same thing. Masks, distance, hand washing, and the vaccine. All this should be protecting us against the new variant. I would also recommend that people don't travel. We've been saying that before, but it's another reason not to travel, because if you do travel, you're more likely to come into contact with this virus. I'm going to need to continue to simply follow the story as the science and the studies emerge. Then an update on our safer at home restrictions. Our safer at home restrictions went into effect on November 20th. From then through yesterday, by data that the Commonwealth of Pennsylvania posts on their website, looking at the 7-day average case rates, Philadelphia's case rates have fallen 41%. During the same time period, for the Commonwealth as a whole, case rates have risen 16%. Also during that same time period, Philadelphia County's case rates went from being the highest in Southeast Pennsylvania region to now being the lowest. So we see this as evidence that the restrictions are working, and that's a very good thing. But there's still many reasons to be worried. Our case counts and death rates are still very high. And we know that many people traveled over the Christmas holiday, and I'm concerned in their travel that they've been exposed to others. So we'll begin to see the effect of people traveling and visiting with people over the Christmas holiday in the next few days. And we'll begin to see the effect of any New Year's gatherings at the end of next week. Unfortunately, if there is a spike for Christmas and one for New Year's, these two spikes may run together and they may feed off of each other. We won't see the end of them until about January 15th. So just a reminder from what I said last week, we'll maintain the current restrictions for the riskiest settings through January 15th. That means no indoor dining at restaurants, no indoor gatherings or events, no theaters, no in-person instructions at colleges, no indoor organized sports. Now, if the case rates don't rise more than expected in the next few days, we will still allow the somewhat less risky settings to restart when the governor's restrictions expire on January 4th, or later if the governor were to extend them. That means allowing museums, outdoor sports, gyms, high schools for in-person learning, and outdoor catered events. But there'll be restrictions on all of these on how they operate so they can operate as safely as possible. Most important for indoor activities, including gyms, masks have to be worn at all times. And we're going to put limits on the density of no more than 5 persons per 1,000 square feet. So what should people do right now? Well, most important with these holidays here, no indoor gatherings. Don't get together with people outside of your household. If you want to get together, do it outside with masks. Don't go to New Year's Eve party. Celebrate with your immediate household members only, the people you live with every day, not with relatives or friends who don't live with you. And it doesn't matter if they've been tested. Don't get together with people outside of your household. It's particularly important right now. So that's the news. If you want more information on all this, just go to our website, www.phila.gov/COVID. Thanks.
Thank you very much, Dr. Farley. We'll now move to the Q&A portion for members of the media. Reporters are asked to limit their questions to 3 or fewer. We will do a second round of questions if we've got time. Please try to keep your questions focused on the topic at hand, which is COVID and the COVID response. For those logged in today, please use the raise your hand feature. It can be found under the participants list. We also ask that you use video to ask your question if you're able. We will now unmute reporters one by one to ask questions. First up, we'll go to Mitch Blocker from Channel 10. Mitch, you're unmuted.
Thanks, Jim. Thanks, Dr. Farley. Happy New Year. I was wondering how you feel, if you could talk a little bit about your feeling on the speed of vaccine production and the potential vaccines that are in stage 3 trials. Are you feeling hopeful? Are you skeptical? Where's your head?
Well, the big picture, let's remember that we're only a year into this new pandemic with a new virus, and we're offering vaccine. That really is an incredible feat. I never would have predicted that. So that's exciting. Having said that, we wish the vaccine were being produced faster than it is. I would love to be able to offer the vaccine to the entire city right now, and I can't do that. It's going to stretch out over months. The more vaccine we can get, the sooner we can get it, the better. And so there are these other vaccines that are in trials. There's the AstraZeneca vaccine, the Johnson & Johnson vaccine. What I've read is that they may be announcing their results in January. I don't know anything more than that. So I'm hopeful that they'll announce in January and that they'll find that these vaccines are effective and that they can quickly get approval, and we'll be offering them as well. I can't make a prediction as to when that's going to happen, but the sooner the better.
How do you feel about the federal government being more involved in actually administering shots? Do you think the federal distribution and local administration of the vaccine is working? Is that the most efficient, or does the federal government need to be more involved going forward?
You know, we have a very fragmented healthcare system in this country, and it's less than ideal because of that. But, you know, overall here in Philadelphia, we have high immunization rates for children. We have a pretty good system for distributing vaccines through our distributed healthcare network. And so I think the general approach the federal government has taken is the right one. The federal government coordinates things at a high level with the companies and then ships vaccines out to the local government to distribute. Nothing's going to be perfect. And especially when we have a low number of vaccines, not everyone's going to be happy, but I think that the general approach is the right one.
And one last question. I believe this week we've crossed 10,000 Philadelphians receiving at least their first vaccine dose. I just wonder, when you think about 10,000 Philadelphians getting their first shot, what feelings, what does that elicit for you? What do you think about?
Oh, I'm very excited. Very excited the idea that really these are people who are going to be protected. I do believe the vaccine is going to work for them, and so that they need to get that second dose, but they'll get that. They'll be protected, and then that's 10,000 fewer people that I need to worry about, and we can focus our energies on the other folks. So it really is exciting to get to this point. It's been a tough epidemic for us, so this is really just great to be at this turning point.
Thank you, sir. Happy New Year.
Thank you very much, Mitch. Next, we're going to go to Pat Loeb from KYW News Radio. Pat?
I just wanted to clarify. You said that the current vaccines are effective against the new strain of COVID-19?
That is what the best expert opinion is. Now, we're going to learn more, but that's their assumption, is that the vaccine, the new variant is similar enough to the old variant that it should be protected against with the vaccine.
Okay, thank you.
Thank you very much, Pat. Next up, we're going to go to Kennedy Rose from Philadelphia Business Journal. Kennedy?
Hi, Dr. Farley. Happy New Year. Just starting out, I was wondering, for outdoor dining, are there still time restrictions in place that ends outdoor dining at 10 p.m.?
I believe that those restrictions might have been at a statewide level. Let me get back to you on that. I don't want to say something that's incorrect.
Okay, just because my next question was for the holiday, for New Year's, if that is still in place, would outdoor dining be allowed to go past 10 p.m. for, people who are looking to go out to, say, like a late dinner for the New Year celebration, or if that's a state law completely out of your hands?
I don't want to say anything that's wrong, and I'm embarrassed to not have the answer for you, but let me try to get that back to you. We'll get back right after this.
Okay, I'll follow up with you after. Thanks.
Thank you very much, Kennedy. Next up, we'll do Jack Tomczyk from Metro. Jack?
Yes, hello, Dr. Farley. Thanks for taking my question. Is there any information on the nursing home distributions? Have injections been administered yet? Have the pharmacies reported any doses to the health department that they've administered?
I was told that they were going to start this week. Have not heard of any taking place yesterday, but there might have been some taking place yesterday. I don't believe we have any data yet from any of those administrations.
Okay, thank you. That was my own question.
All right, thank you, Jack. Next up, we'll go with Trang Do from CBS 3.
Hi, sorry, I wanted to turn on my camera. Hi, Dr. Farley.
Hi.
Just really quick, if the numbers go up after the holidays, as you mentioned, you might not know until a week or so after, particularly New Year's. Do you anticipate extending those safer at home restrictions?
Well, I'm hopeful we won't have to. That's why we did extend already the riskiest settings until January 15th, because we anticipate that we're going to have some increase from the holidays. I'm hopeful that we can still allow the somewhat less risky settings to restart as of January 4th.
Still muted.
I'm good. Thank you.
Excellent. Thank you very much. All right, next up, we'll have George Solis from 6ABC. George, go ahead.
Thank you, Dr. Farley. Happy New Year.
Hi.
Question. So with the allocation of the Pfizer and Moderna vaccine in the city, are health systems and providers required to give all of them out as soon as they get them, or is there an updated plan? I mean, are some systems, to your knowledge, not distributing them all at once, keeping some? Is there any kind of plan for that?
All systems have many more people who qualify for the vaccine and who want the vaccine than we have doses. And so they're going to be giving out that vaccine as quickly as they can. I don't believe that any of them are holding on to the vaccine. They certainly shouldn't be, because there's plenty of people who should be in the queue. We had a larger shipment of the Malandra vaccine last week. I believe it was 27,000 doses. We're getting, something like 9,000 this week. So it may take them a little bit of time to get through the 27,000 doses that we got last week. But basically, we're going to be able to, we believe, distribute this vaccine, get it in the arms of people roughly as quickly as it comes into us in the city.
And then my follow-up question is the health department offering guidance to private practice doctors and dentists and other medical staff to get the vaccine for their staff, especially if those doctors are not affiliated with the hospital system? Is there a guidance for them yet?
Yeah, so there, for those that are affiliated, even with a loose affiliation with healthcare systems, those healthcare systems will, in all likelihood, be able to offer the vaccine to them. There is a email address for unaffiliated healthcare providers and doctors' offices for them to contact us, and we'll direct them to other places where, if they're unaffiliated, they can go to get their vaccine. And I'll get that email address to you.
Okay. Those are the questions I have. Thank you.
Thank you very much, George. Next up, we'll go to Martin Pratt from Philly Your Black News. Martin, you're up.
Hey, Dr. Farley. There was a case recently of an ER nurse receiving a vaccine, and then he presented with COVID. Can you explain the concept that, or what powers the concept that within the news report, the local CDC person said, this is to be expected within the clinical trials that we're seeing? In other words, he could have had the vaccine, he could have had the COVID, presented with COVID a week before he got the vaccine, or all the intricacies. Because right now on social media, that's trending. It's starting, especially within the Black community, of like, aha, he's got the vaccine and he still got COVID. So I would love for you to address, how that was behind that.
I haven't heard the particulars of that case. Do you know how long after the person received the vaccine that person ended up developing the infection?
I believe it was within 10 days. Let me check. But I can definitely check while you, I believe it was in the 10-day mark. It wasn't 14 days afterwards.
All right, yeah. So the vaccine is going to take a while for it to have an effect. It induces a response in the immune system, which then protects the body against the virus. But there is a delay before the immune system is fully operational. With 6 days. Sorry, Dr. Farley. All right. Yeah, I would say it's going to be at least 7 days after you get the first dose of the vaccine before your immune system has any effect. And of course, the reason for you're getting 2 doses of the vaccine is that not everybody will get a strong effect with a single dose. And so probably you're about 50% protected with a single dose and about 95% protected with 2 doses. So we would expect that some people, if they happen to be exposed right around the time that they were vaccinated, come back positive within the next few days. We'd expect fewer people, but not zero, that might come back positive even a month after they get their first dose. And a very small number of people, even if they get 2 doses, might still get the infection. The vaccine is 95% is a fabulous vaccine. It's a very, very protective vaccine, but it's not 100% perfect. Okay, there's going to be a few people it won't protect. Not a reason not to take it. Measles vaccine is about that, very effective vaccine, and we got rid of measles in most populations with this vaccine. If people get 2 doses, we'll still see a great decrease in the number of infections overall.
And can you explain another rumor that's been going around trending that COVID-19 can you explain whether or not COVID-19 is inside the vaccine?
Oh yeah, the vaccine does not include the virus. The vaccine only includes a protein, a little tiny piece of the virus. Actually, I'll take it back. The vaccine doesn't even include that. It includes instructions on how the body can make a little protein, which will then induce the immune system. So there's no virus in the vaccine at all. There's no risk of getting the infection from the vaccine.
So the instructions, to go just a little bit deeper for that, the instructions, can you explain what that means in layman's terms, that there is a roadmap or a direction?
Right. So our body cells at all times make things that are called proteins that do a lot of work within the body. What the vaccine is instructions on how to make a very specific protein that the virus uses to attack a cell. Then the body sees that, it makes that protein, then the body recognizes that protein as being foreign, something shouldn't be there, and then it develops an immune response to that, antibodies to that protein. Once the body has those antibodies to the protein, then when the real virus comes along, it recognizes it immediately and can kill off that virus.
Excellent. Thank you so much.
Thank you very much, Martin. Next up, we have David Malandra. David?
Hey, Dr. Farley, I got a couple questions for you. As we know, in the city of Philadelphia, high school basketball and pro and college sports are really big in the city. What is your concern about when, on January 4th, high school sports are given the green light to start up, especially for high school basketball?
Well, anytime people are indoors and getting close together, as you would in a basketball game, and not wearing masks, as you would in a basketball game, there's a risk of transmission. So we're concerned about that. And we're concerned about the players, even more so we're concerned about spectators. And so we do have restriction on indoor organized sports right now. We don't want to have our high school players getting infected and passing it on to their family members.
And my final one for you is, as we know, last couple of times you mentioned about what's it going to take for, say, in April when the baseball season starts up, that people can be allowed into the stadium. What do you believe it's going to take for the city to sign off on that? Because I've been getting a lot of questions about that.
About specifically baseball games in April?
Well, I'm talking about just having fans back in the seats, because a lot of teams are saying that they've lost so much money with the revenue not coming in.
Yeah, it's April's far enough off, and there's so many other things happening. I can't really speculate. I could simply say that we hope that the virus gradually will go down as far as number of cases with each month after January. Most respiratory viruses do that. We hope that we're distributing a lot of vaccine by April, and that a good percentage of the city is vaccinated by then, and that outdoors is safer than indoors. So you put that, I'd say that I'm hopeful that we will have fans in the stands in April, but I certainly can't guarantee it.
All right, thank you.
Thank you very much, David. This is the last call for questions. I've got Pat Loeb from KYW News Radio. Pat? Pat, it looks like you're muted now. If you're unmuted, if you want to give it a try. All right, Pat, I'm not hearing you. If you want to reach out, we'll give it one more try. Pat, can you hear us?
Hear you. It was showing me unmuted, but can you hear me now?
Yep, you're good to go.
Okay, thanks. Dr. Farley, last week you said distribution would begin in nursing homes. This week, has it started or is it still on track for that?
Yeah, it is definitely starting this week. I have not heard of any nursing homes getting visits from pharmacies yesterday. It may have taken place without my knowing about it. But I do expect it's happening this week. It's managed by the pharmacies through a relationship between the pharmacies and the nursing home. So we're not in that information loop, so I can't give you the details, but it definitely should start this week.
Okay, thank you. And if someone has tested positive recently, can they still get the vaccine, or if it was, even if they had it, should they still get the vaccine?
They can still get the vaccine. The general feeling is that if you've had a recent infection, it probably doesn't make sense to get the vaccine now, but maybe after 90 days after that infection, then get the vaccine at that point.
Okay, thank you.
Thank you very much, Pat. It looks like we've got a couple questions in the chat. Mike from the Philly Tribune, let's see if we can get you unmuted to ask a question.
Yes, yeah, thank you.
Mike D'Onofrio.
Yeah, Dr. Farley, do you have any? Do you have a breakdown of racial data on those who have received the vaccine already?
We don't at this point. We hope to have that in the future, and if so, we'll make that available to you.
Okay. And then any update on the financial assistance that you referenced last week for restaurants who are interested in offering indoor dining? I remember you touched on that last week.
Yeah, no, it's something that the Department of Commerce is working on, and I don't have an update for you on that. It probably will take some time for them to work it out.
All right. And then in terms of the distribution of the vaccine among nursing homes, how is that being done equitably? I mean, you said you don't have any figures yet, or if they started or not. But how can people kind of be assured that it's being done equitably and given to all nursing homes, or
So we have been in contact with nursing homes. We know that every nursing home in the city has signed up to have a vaccine team from the pharmacies come there and offer the vaccine to all the staff and all the residents. So we can assure that.
So just to be clear too, because I don't know if you said it earlier, so nursing home residents have to go to a pharmacist or a pharmacy to get it?
No. The pharmacy will go to the nursing home and offer it on site to both the staff and the residents.
All right. And then maybe just lastly, what effect do you think a Mummer style parade on 2nd Street could have? I know it's up in the air whether this protest will even happen on New Year's Day, but what could be the consequences of a large gathering of people on New Year's?
Well, we're not recommending people do gatherings anywhere, certainly not indoors and not outdoors with large crowds of people, because even though outdoors is safer than indoors, if you still get people close together, lots of possibilities for it to spread from one person to another. So a big crowd on New Year's Day is not a good thing. The city is not issuing a permit for the mummers. It won't stop the mummers from gathering, but we're asking them to please don't gather on New Year's Day because we don't want to see a spike in infections from that event.
All right. That's all I got. Thanks.
Thank you very much, Mike. We have a question from Sean Walsh from the Inquirer, who's having trouble logging in. I will read this to you. Sean asks, what is the current plan for vaccinating first responders like police and fire?
So first, let me just say that the emergency medical technicians who are part of the fire department already are being vaccinated. They have the ability to vaccinate themselves so that they've been given vaccine and they're vaccinating each other. Then as right now we're in phase 1A, which is healthcare workers, of which emergency medical technicians are in that group. Then we move on to frontline essential workers, which will be police officers and firefighters. And so when we get to them, then vaccine will be offered to them as well. Probably that's going to be on the latter part of January. I don't have an exact date for you, but it's not too far off.
Excellent. Thank you very much, Dr. Farley. And it looks like we have one more question from Martin Pratt from Philly Your Black News. Martin?
Thank you. Dr. Farley, when are we getting, or if we are, is Philadelphia receiving the second vaccine, and will it be rolled out in the same way as the first?
So Philadelphia already is receiving the 2 vaccines that are available, both the Pfizer vaccine and the Moderna vaccine. The Moderna vaccine came a week after the Pfizer vaccine. Excuse me, I believe that was, I forget if it was last week or the week before, but we got that, and we'll continue to get allocations of each of those 2 vaccines on a weekly basis from here. I know a little less than 10,000 per week is what we're getting for the next 2 weeks. Then after that, we'll find out. We just don't know what we'll get after that.
How is the separation? Is it who gets what vaccine? How's that being decided?
So the Pfizer vaccine is the one that needs to be stored ultra cold. And so that really limits where you can distribute it. So that is being used more in hospitals, where we have several hospitals that have these ultra cold storage freezers on site. The Moderna vaccine is much more flexible, so it tends to be used in more locations. So it's really more on a practical basis. The 2 vaccines, as far as I'm concerned, are very similar, and I see them as essentially identical in terms of the way that they work and their effectiveness and their side effects.
Okay, thank you so much. Have a good holiday.
You too.
Thank you very much, Martin. Seeing no more hands raised, we'll conclude today's press conference. Thank you all. Have a happy new year and stay safe.